All right, welcome to the September 2nd, 2021 special open work session at 6:30 p.m. Can I get an approval of the agenda?
So moved.
Second.
All those in favor?
Aye.
Any opposed? Okay. All right, study items, COVID-19 mitigation measures. Dr. Jason.
Thank you. First, appreciative to have the opportunity to come back and discuss some updated data, and then also to begin to dive into some of the research that supports some of the decisions of the administration, but most importantly, to really think about what we need to put in place for the safety of our students and also our staff. So as I was thinking about some of the questions that were posed from the board members, a couple things continue to pop into my mind. A, how do we ensure that we are being transparent in the data that's being collected, which supports some of the questions that were actually asked by the board members? And the other piece is, how do we ensure that we continue to have a safe and healthy learning environment for students for in-person learning? And so, in thinking about the experiences students had last year with virtual learning, we know that it created some opportunities for acceleration. And so I just wanted to bring us back to the purpose of why we're here, and also the data that supports that as we move forward. So I provided to the board several articles to review, and I am not going to read this, but I just basically put it there. But a couple things I wanted to point out was the research around the use of face masks, and we received a lot of questions about whether or not there were long-term effects for the use of face masks, but the research currently says that prevent the spread. It also ensures that there is less disruption so that we can keep students in school in person. Now, I will say the research and all of the information provided did not have a whole lot to support vaccinations. However, it does talk about the impact of vaccinations with decreasing the amount of time that staff members and or students would have to be hospitalized or any further medical conditions that may surface. So I know that the board had an opportunity to review some of those articles, so I wanted to open it up to see if there were any questions and have some conversation around things that you might be wondering in regards to the research that was provided, in addition to our current mitigation measures.
I think the articles were helpful, definitely, pretty informative.
So just to kind of remind us where we are with our mitigation measures, and I continue to put this at the forefront of the decisions that we're making, because it is not just vaccines, it is not just masks, it is a layered approach. And when you begin to remove those items, that's when we begin to see breaks in how we, A, keep students safe and also keep staff safe. But we are continuing with our face mask coverings, again, regardless of vaccination status. The use of social distancing where appropriate of 3 feet or more, continuing with the daily health screenings, and then also practicing hand washing and sanitizer, and then routine cleaning. And I will say that our custodial staff and those extra individuals who are providing support have been working overtime, including our nurses. And it is not easy, particularly with the Delta variant and how quickly it is able to spread and the impact that it's having currently on children. So received a lot of emails, and thank you to the board for the clarifying questions. They're helpful for me to guide my approach as I work with my administration. So wanted to put back in front of us the idea of the metrics and indicators that we look at on a regular basis. And so what you will see is that we're looking at the daily new cases, the total positivity rate, and the transmission rate. And looking at what we have here, we're really looking at the changes in the cases over time. And so is there an increase, a decrease, or if we are stagnant and have no changes? So the hope is to be in the yellow and green. But with the Delta variant, what we're finding and what the research is supporting is that it changes quickly. And I'll give you an example of that just earlier, changing the data that was received. We're looking at positivity rate. And again, we want to either be between 5% to 10% or either less. And then also transmission rate, anything below 1%. And so in previous presentations, you saw that we were above 1%, but even from the information that was provided in the presentation, it changed as of yesterday. So this is what I reported when I loaded the item into board docs. And so the positivity rate at this time on August 30th was 10.5%, and the transmission rate was 0.96%. Well, of course, I looked at it again today, and the transmission rate is 0.97% with the positivity rate of 9.90%. So again, the numbers continue to change, and as that information is being received, we are continuing to have conversations as an administration regarding what's the impact and what shifts we need to make to ensure the safety of students and staff. So this looks different. So listening to the board, listening to the questions that were coming from families, because it is critical and important that we continue to be transparent. So the data previously was updated weekly, and what we recognize is that the Delta variant works quickly. So now we will begin updating the dashboard twice a week, and so Tuesday and Friday, so that parents, families, the board, staff can go in and see where we are. And we also added students in modified quarantine, which is very important because we know that we are seeking to keep most students in school. So you'll see where we are. We currently have one active staff case, and then currently we have one active case, and then for students we have 6 active cases with 5 students in quarantine and 37 students in modified quarantine. And so right now our current district-wide rate is 0.3%. Again, continuing to watch that. The other chart that you see to the right is actually a weekly staff student cases, and that's an aggregate. And so you will see, if you look here on this particular chart, that orange bar is new and it wasn't previously there. That reflects the modified students who are in modified quarantine. So I think as we think about transparency and staff feeling comfortable, the request was made for weekly updates, and I was very clear that's very difficult to do because of the amount of time to contact trace and to make sure that we are really looking at who needs to be quarantined and who needs to be in a modified quarantine. The other request that we're working on is looking at tracking cases by building level. And so this is the information that's there. Thank you to Phoebe and also Kelly and Vince for working today to get those changes updated. So if you were to go out on the district website, it does not look like it looked before. And we are also adding, for clarity purposes, the definition for quarantine and also modified quarantine, so parents and families have an understanding of what the differences are between the two. And those were several of the questions that we were getting. So I want to kind of jump into this data, and I will tell you that it was changing as quick as I could blink my eyes. And so Roxana was giving me updates saying we have one more. So right now our current vaccinated staff rates are 88% of the respondents. Now that could be different from the time she provided that on August 31st. We have 11 employees who are unvaccinated. We have 8 who declared that they did not want to respond. And we have 18% of our SSD staff vaccinated. So I wanted to clarify that point because that information was actually provided from the Human Resources Office from SSD. However, in conversations with Ben Gleason, he indicated that there may be some discrepancies with the data, so I encouraged him to reach out to Human Resources, and these were the numbers that I was going to report. But I will also say that SSD has implemented vaccination and or weekly testing, and they're giving their staff until I think the first week of October to submit that information. So by next week, when I give an update, that information will look gravely different. So Rachel asked a couple questions around subs and also questions around who can retire, who can't. Again, thank you, Roxana, for pulling that information. So last year for 2021, we had about an 80% fill rate. So currently we're at about 50 to 60%. Now I will tell you that's alarming because if we have a number of staff members who are out, especially when we think about the impact of the Delta variant, we very well can have classrooms that are not covered. And because of the Delta variant and the need for social distancing, we can't combine rooms. And so that is a critical data point that I wanted to share. In addition to the number of staff who could very well decide that they just want to take a very long extended leave. And so we have 23 staff members who have 75 plus days of sick leave that they could take. So again, as we think about decision making, whether staff are in classroom, if they're healthy to be in classrooms, that also can have an impact on whether or not we have classrooms without teachers if we're trying to continue to offer in-person learning. The other question that was considered is how many teachers, if they are in a place where they feel that they want to retire. We have 15 teachers who can actually retire with 20 years, which would be 25 and out. So I wanted to be very transparent about the impact of the decisions that need to be made, if made, and how that can impact whether or not we're able to offer in-person learning. I will say currently we had about 8 vacancies, and some of those vacancies are for like Discover Club and some of those hard to fill positions. I will say that that's not just a position that's here in MRH, that is regionally that we are finding that there's a shortage in being able to fill those. And so some are being creative by offering sign-on bonuses, some are being creative and looking at other ways that they can utilize staff to fill those gaps. But that is a current gap for us. So I wanted to pause there to see if there were any questions around like the data or any wonderings the board might have at this time.
Can you remind us again how many SSD staff are part of our ranks here in the district?
43. We have currently 43 SSD staff members. And I will also share that there is no delineation regarding their role. So if you offer PT/OT and you're only with students 1 day a week, you still are an SSD staff member, you still are interacting with our learners. Thank you for that question. Any other
Anita, I apologize if you mentioned this, but Kelly subs, do they have a policy on the vaccine and a mandate?
I'm glad you asked. So I did have Roxana to reach out. We are able to require them to have staff who come in MRH to be vaccinated. Again, looking at the current fill rate and depending on how many subs we might need, it may create a barrier because we wouldn't have subs to come in and actually fill classrooms. And Kelly services several school districts, and those districts are also struggling with fill rates.
Okay, thank you.
All right, so I'll jump into a couple of policies that have been reviewed. So ongoing conversation with Cindy Ormsby regarding what we might be able to look at. And so there are 3 policies that we looked at regarding how this might impact how we function on a daily basis, and also what the impact would be on human resources if a decision is made to require staff to either wear masks and or vaccinate. So the first policy is GBCB, and that's staff conduct. So why is this particular policy here is because we as administrators can give directives to staff, i.e. vaccinations and or weekly testing. Now, if a staff member decides that they don't want to do either, then you have to think about what does that recourse look like. And so we talked about a graduated response, email, conversations, etc. If a staff member would choose not to do either, then you're beginning to have a different kind of conversation. If they are a tenured staff member, which you would have to come up with a statement of charges and kind of move forward that way with recommendations for termination. What I will say is I don't particularly feel convinced that that is going to change a person's mind regarding vaccinations and or testing. I believe that anonymity, confidentiality, handling people with care, and recognizing that they do have a choice, and having those ongoing conversations would be better suited. But that is one policy that could actually be enacted if a staff member chooses not to do one or the other. So the other policy is GBCBC, which is staff absences and tardiness. And so as we think about what the impact could be if a person chooses not to be vaccinated on the classroom, there is a policy that talks about the extensive absences of staff members if they choose not to be on campus. So I wanted to include that one. And then EBB is more so around communicable diseases, and that we do have a responsibility to protect the health and safety of our students and employees. And so I wanted to put those in front of you so that you can be aware that there are policies that exist that would allow us to support the decision or recommendation if made. So Roxana has already started the process for saying, well, what might this look like? So there is a Dropbox option, which again ensures the confidentiality for staff to upload their vaccination cards without anyone knowing, and the only person who would have access to that would be human resources. So again, that confidentiality being offered to staff so that they continue to feel safe as they think about how do we continue to support students, because it is important. They are the ones who have the connection with our students, that they feel that they're in a safe environment as well. Any questions about the policies listed here?
I had a question about the tracking that you're talking about, the confidential upload. Have you given thought to how subsequently you will record and retain that information to verify booster status, for instance?
We would use the same Dropbox system with a different channel that would be each week would have its own Dropbox on the same personnel, which would be my assistants and myself would be completing those lists, but we'd use the same piece. They'd either have to deliver it in person or send it electronically through the Dropbox.
And so then you would track using a spreadsheet, for instance, to trigger the request for an updated vaccine card?
Taking notes. So a couple of the questions that came out from the board was engagement of staff, and so the question around surveys. So I will say that there are unintended consequences when you begin to survey staff. Why am I saying that? Because sometimes when you survey staff, the thought or assumption is that survey means that I am making a decision. The majority will determine what approach is taken. And so we decided to do a focus group with a cross-section of staff from each building, which included teacher unions and teacher leaders from the building. And so these are some of the topics that were discussed, and then also some things that they brought back to administration around wonderings that we thought about and tried to consider. So we asked those individuals to go back and share that information with their team members, and the minutes and notes were sent back out as well for them to be able to share. And so the aim with that was to provide an opportunity for some discourse among staff members void of administration, so that if there were other issues or concerns that came up, they could do that in a safe manner without having to feel as if administration has a perspective regarding what they shared. At this time, I am going to turn it over to Cindy Ormsby. She is going to share what's happening regionally around COVID leave, vaccinations, and then I will pick back up.
Good evening. It's great to be with you all again. So I just wanted to update you. There are several boards that are in exactly the same place that you are, gathering information, trying to make a determination. There are a couple of boards that have made the decision, but they haven't made it public yet because they're waiting to get details on how the program is going to work. I anticipate in the next week to two, you're going to hear of other boards coming to some sort of decision on this, just as you're considering it. Currently, we know districts that have made a decision or are in the process include Ferg Floor, St. Louis Public, Webster Groves, Brentwood, Afton, Special School District, and Hazelwood are all districts that I'm aware of that have made a decision or are considering it. And those decisions, will include nothing all the way to requiring vaccines and requiring tests both. Some districts are even considering that because of the Delta variant and because you can still. So there's and then everything in between. You guys, Benita already talked about a lot of things. I was going to touch on the fact that Kelly Services, the contract does state that if the district requires it, they will also require the subs to go. Every district is facing the same issues with lack of subs and lack of coverage and concerns. You can require your contract employees, if you have any, also to be vaccinated. That's not an issue. Districts are considering some incentives as along with any sort of mandate. Some of the things I've heard that are being considered are allowing the staff member to have 2 days off that won't count towards that will be paid but won't count towards their compensable leave while they're getting their vaccine and maybe recovering from any side effects of it. That's something that some districts are considering. Another is actually monetary incentives, anywhere from $250 to $500. I would just remind you, as I stated at your last meeting, that that would have to include the employees that have gotten vaccinated on their own voluntarily. It couldn't be an incentive from like this point forward, because it's sort of then a punishment to those who have previously vaccinated. So you would have to look at what the budget ramifications are for something like that. Some are looking at incentives for students. It seems like staff members are vaccinated already at a much higher percentage than the eligible students. So they're looking at incentives such as you need to show proof of vaccination to attend dances, to attend football games, field trips, or anything like that, that you wouldn't be able to participate unless you showed your vaccination card. And there are even some districts are thinking about drawings for prizes for students. The vaccinated students get to put their name in a hat and they draw for prizes, sort of like what you've seen done on some state levels. Let's see. We already talked about the fact that you need to give a time from the time if you should decide to require vaccinations, you need to give a time period for staff to comply with that. Usually 5 to 6 weeks when you think about how long between the two vaccines, and then the 2 weeks to actually be fully vaccinated. You don't really need to count those extra 2 weeks for someone to provide proof of vaccination, but just knowing everyone needs to know that you're not really fully vaccinated until those two weeks have passed. Most people most districts are having portals where they can electronically upload their vaccine cards, just as you all are considering. And then there'll be a list usually distributed to the building principals of who is not. Somebody will know. I don't know how, your district is a little different because it's smaller, but how to control who's not vaccinated and who needs to provide those weekly or bi-weekly. Some districts are requiring 2 tests a week. How are they going to provide that, and who's going to control whether, if someone doesn't comply, that they don't come to school if they're not complying. Most districts that I'm working with are requiring the teachers that are choosing not to vaccinate and are choosing to test instead, that they test on their own time. They're not giving time off to go get the test. The test, if there is a cost involved, that it is their cost. It's not a test that the district is picking up. Most districts are providing an extensive list of where you can receive that test. County-wide, depending on where someone lives, that would make a difference. So that information is pretty easily attainable from the Department of Health of where you can obtain vaccination, and even providing information such as, is an appointment required, or is it walk-in, or just giving as much information as possible about where you can get tested, but letting them know that time is on their time and the cost is their cost if there's any. There's lots of free places to get vaccinations as well. As you've probably heard, and I think there was an article, it's kind of buried in an article this morning. Several districts are working with WashU and have drive-through clinics for both students and staff. That also brings up an issue of whether or not that's a private, people could be stalking out who's getting tested or not. So privacy might be an issue, but that is something that some districts are providing. But again, when you drive through would be their time, not district time. Decide whether or not rapid tests are sufficient or not, whether or not a rapid test, or do they actually need the PCR test. So that's something that needs to be considered. And then what to do when you have a positive test. You're going to have positive tests. So, if you're unvaccinated and you're positive, just some districts are saying you can't use compensable time for that. Other districts are saying, fine, you can use your compensable time, but when it's gone, it's gone. And after that, it'll be unpaid leave. So those are things to think about. And then the discipline. What are you going to do when someone decides, I'm not going to comply? I'm not going to get vaccinated. I'm not going to be tested. do your best. The good news is both of the teacher unions, and I know teacher union isn't a big thing here at MRH, but all the teachers unions are actually supporting mandated vaccines. And so what the unions have decided to do is, for a teacher who decides not to get vaccinated and not to comply with directives, is to ensure that that teacher gets the due process that they are entitled to under law, but they're clear that they don't agree with the teacher's decision. So they'll protect their due process rights. And what does that look like? Really, it means that if they are due a hearing, if the teacher wants to go to a hearing, they can do that, make sure that all of the steps leading up to the hearing are complied with, but they're actually advising that staff member to resign rather than to go forward with the hearing. Why is that? Because it always is better to have a resignation than a termination on your record when you go to look for another job. So the sorts of discipline or progressive discipline that districts are considering is, so if someone's not tested and they're not vaccinated, do you really want them coming into HR to meet with someone one-on-one, even with a mask? That could be dangerous. So most are thinking of video conferences and emails. Day one, to just say, hey, you're not in compliance, and you're using your compensable time, or your compensable time's not available to you, whatever you decide. Most are letting teachers and staff members use their compensable time until it's gone. But just to say you're not in compliance with board policy, because it's not an excused absence that a doctor is going to give you an excuse for, and you're insubordinate because you're not complying with a reasonable board directive. Notifying them of that and notifying them if they do not comply that there will be further consequences. That's sort of like day one. Day two, the same sort of meeting with the principal, informing them of exactly the same thing, and just sort of feeling them out on, where are we going with this? What can I do to help you comply? Is there any things I can answer, questions I can answer? What concerns do you have? Can I direct you to somebody to address those concerns? That sorts of things. But on day three, it starts to get a little bit more serious. And this time, you still have the video conference or whatever meeting again. And this time, though, that you put something in writing that says you are, in writing that you are not in compliance with board policy or board directive, and you're in violation of the district absentee policy. Day four, it's now a letter of reprimand. So you just start layering things. And then the fifth day is we're turning it over to HR. Normally these conversations are just with their supervisor. The districts are providing scripts that can help with that if you need any help with that. But then the fifth day is we're turning it over to HR. HR, if it's a tenured teacher or a contract employee, HR will be working with legal to develop a statement of charges and notice of hearing. So 5 days, usually you can stretch that out however you want, but usually we're looking at about 5 days, mainly because your policy says if you miss 5 days in a month, you're in violation of your absentee policy. So that's where they're choosing the 5 days from. I need to hit on most of what are the impacts of doing this, and she already talked about we don't have a lot of subs. We can't combine classes anymore because that would violate some of our other mitigations that we're taking. But I wanted to point out this is also going to be a strain on your HR department. And some districts are having to look at actually hiring temp workers or part-time workers to come in and assist with that, because not only are HR tracking vaccines and tests, but they also have whatever HR normally does. So this is in addition to what that department is doing. So that could be something that would be an impact to the system. It could ultimately impact in-person learning if there's not enough staff members to cover the classes. Some classes might have to go back to remote learning. And also it could be an increase in ADA, FMLA leave, and just requests for leave of absence to HR rather than complying. So those are all things that you're going to have to consider as an impact should you go forward with a decision to mandate testing or and/or vaccines. I'm happy to answer any questions. I kind of went through that quickly, but I wanted to give you guys an overview. You guys are thinking of all these things already, but maybe there was one or two things I said that, oh, I hadn't thought about that yet. So I'm happy to answer any questions.
I do have one. Does that include boosters? Would it automatically kind of be included in that?
It would be one. I think people are kind of waiting for a final say on that from the CDC or from someone like, yes, you definitely need a vaccine this many months after. We haven't gotten that yet. It's been suggested that that's a good idea. I'm part of the Moderna vaccine trial, and I just got a letter this morning from them saying we're going to start bringing you guys in for boosters, and they're basing it like 6 months after your first, but that's part of the trial. So they haven't made a final decision on when and if they should, except for if you are immune compromised. That's the only thing the CDC has come out officially and said, that those that are immune compromised should get vaccines. And by the way, if you are immune compromised, I didn't know this, and my daughter is, and she actually got an email from her pharmacy that said, hey, you're on this medication, obviously you are probably immune compromised, you should come in and get a vaccine per the CDC recommendations. That's not happening to the general public yet. But once it does, I think that you're going to have to then, if you required the vaccine, you're going to have to then require the booster as well.
Okay.
Cindy, this may or may not be a question specifically for you, but one of the other impacts that I'm thinking about is, should we have a staff member who contracts COVID and, you know, again, God forbid, ends up gravely ill? We're a small district with a insurance, pool that gets thrown off very easily. And just wondering about, what we may have seen in other districts, that have had that happen. I think those of us who've been on the board for a few years have seen a year when we had a couple of catastrophic things happen and some pretty serious insurance, premium upticks for us.
Yeah,
right?
yeah. I haven't seen the numbers from the insurance company yet from last year, which would have been pretty much last year, but I will make those inquiries of my other districts and see if there's been any, especially the larger districts, because I know there have been deaths, unfortunately, in a couple of districts from staff members, back when we were even virtual. So, but I'll check on that for you. I'm happy to inquire. Any other questions?
No, thank you. Sure.
Thank you so much.
You.
Thank you, Cindy, for that. So I wanted to jump in, what does communication look like? And so that's also important. So if the board decides to approve the recommendation that will be made, we will first disseminate communication to all MRH employees. And so Ed has already created a draft of what that looks like. It would then be disseminated to our SSD partners and then out to our families. And so he's identified times for that so that they are aware. And then, of course, I would field any questions that parents have and through conversations or via email and share updates as needed with the board. So here's our recommendation. So I wanted to start with the bottom one first to give the why behind it. And so it's to approve the MRH Universal Mitigation Measures. So House Bill 271, currently simmering through. We wanted to give an opportunity not only to say mask, but to look at all of our universal measures, because we know it's all of them and not one, but masks are included. But the recommendation is for all employees to be vaccinated against COVID-19 by October 10th, 2021, which falls into the range that Cindy shared with the board, or undergo weekly COVID-19 testing. Again, Roxana has already started building that process out, thinking about drop boxes, how staff can do that. So in the conversation that was had with the epidemiologists today, they are not recommending antibody tests. And so I will say that that was a question that I got from teachers. They said that it is not accurate because you don't have the point in time, and then and looking forward to how you determine the 90 days that it would be impacted. It does not count against whether or not a person is infectious. So they are suggesting either the saliva test or the nose test to be administered. Don't have a option for whichever the staff member chooses. They highly recommended not using in-home testing, and the rationale for that was a positive test is a positive test, but you could have an asymptomatic person who has a negative test, so that was something that they did not recommend. And so I did ask those questions so that I could be informed to provide information to the board. The second one is to reinstate the MRH temporary COVID-19 leave up to 10 days for vaccinated staff, with unvaccinated employees being required to use their available leave or take unpaid vacation time if they contract COVID. So that is the recommendation for administration. I welcome any questions and open it up for discussion.
Dr. Jameson, Cindy brought up a bunch of questions that I'm just curious about. The testing, she had talked about off time. Are we requesting that as well? Would that be part of the recommendation that all testing be done off in your off time?
Correct.
And the testing is at the employee's expense?
It is.
Okay. Got it.
And I will say, Rachel, that most places that there isn't a cost associated with testing. So I am interested in hearing what the impact to insurance might be, because Katie, that is a good question.
And then what are we noticing already an HR elevated a need for extra staff with HR due to this?
So I am going to allow Roxana to answer that, since she is HR. I know we have been both fielding questions from staff. Thoughts about additional staff at this time?
At this point, we're not anticipating it. Of the respondents to the survey, we had 93% reporting vaccinated. If we count the people that did not respond, that puts us at about 88. So we don't think we're looking at a tremendous large number of folks. And I actually met with my HR specialist today, and we strategized what we thought that could look like for us on a weekly basis, and we think we can manage it.
Okay.
Of the things that we think could, if the only issue will be if folks refuse to be vaccinated and refuse to test, and then that will eat up some inordinate amounts of time while we deal with those disciplinary measures. But I'm not anticipating that.
Okay. Thank you.
Sorry, I'm sorry, go ahead.
Oh, I just said thank you.
Okay. As part of the communication plan and strategy, are we also talking to staff and hopefully maybe community members or individual anxious parents about kind of the interaction between parents and staff as it relates to this issue? I think we definitely have elevated levels of, rightfully so, concern, but I'm also concerned about how the discourse is happening between those two groups.
So the answer to that would be yes. And so I'm pretty visible in buildings. I actually stood out probably for 15 minutes talking to one of our parents and talking about what that interaction should look like, and also thinking about what does advocacy look like. So I had that conversation with staff too, because the thought is that advocacy is supposed to look like a certain way. Like I write a letter that's advocacy, or if I email or make demands. Now there are some things that have surfaced where administration has provided supports to principals so that they can support staff. But I have begun to think about how do we strategize, and then looking at those leaders of those parent and family groups to begin to engage. And I have actually asked several of them to walk alongside administration and be a beacon of light to ensure that the information that is being shared out is accurate, encouraging them to actually tune into our work session, our board members, or if they don't know, to ask the questions. I am very responsive, and so I'm getting back to parents 24 hours. I'm asking the right questions, and even though they are asking and pushing, they are appreciative of the responses that they're getting. So I will say that while the approach is not necessarily the best, I believe that they are advocating on behalf of their children, but also sometimes we lose sight that we have staff who need to be in a good psychological and mental space to be able to support our learners to ensure that they are getting what they need. And so that has been my message. I can tell you that I'm very consistent with messaging, which probably has popped up too in some of the correspondence that you received. And it's not to give a stock answer, but it's to have consistency. Because if I tell one parent something and tell another parent something else, when they begin to talk, because they do, same with our staff, well, I was told this. And so being creative about how we actually engage and also being open to have those conversations. So I am continuing to have them. I will say that I have not considered doing any forums or anything like that, because I do think that creates a space for conversations that may not necessarily support teachers or staff, and we are here for kids. And so that's really been the message, help me to support staff so that we can ensure that we're continuing in a safe manner provide in-person learning. But it has been a struggle. It has gotten better, but we still have work to do because we don't want to divide. We do want to ensure that we're moving in the same direction.
Thank you.
I'll just note, I really appreciate all the work that you've done in responding to those parental and staff advocacy issues. I think it's made an impact in the community. I wanted to ask what considerations you weighed when landing on the recommendation to allow the weekly testing versus just the vaccine requirement period, as some other institutions have done. Can you give us a little bit of perspective on how you arrived at this recommendation based on our circumstances here in the district?
I think the first was more so the actual number of staff that we have vaccinated. Quite honestly, of the respondents, we do have a fairly high rate of staff already vaccinated. I will say that if the number was a lot lower, then the recommendation would have been different. And we are hoping that because the FDA has now approved the vaccination, that more individuals will take advantage of the opportunity to become vaccinated. But I will also say for parents, it's a both and not an either or. And so trying to encourage families to get their children 12 and older who can get vaccinated to become vaccinated, and we'll be sending something out encouraging families to share that information if they feel comfortable. But that was a major part of the decision. And then also thinking about the idea of MRH being innovative and the idea of choice, and we give students choice. And so not to say that choice is it, but how do we continue to ensure that our staff, students are safe, but also doing it in a manner that we're maintaining people's dignity, because we don't want to mishandle. So I would say the high vaccination rate for the MRH staff, again, I am hoping that in my next request for SSD we'll get updated numbers there, because that for me probably was the aha regarding bringing forth the recommendation. Because if you recall the last conversation, I wasn't here yet and had not engaged with administration regarding where we would go. But once that information was received, it was clear that we needed to make some adjustments.
Anita, could I just add one thing that
Absolutely.
we talked about, and that is we have a really high level of fidelity with our other mitigation measures, and we believe that that high level of fidelity from staff and students is an effective barrier of protection. So that's also a really important factor in thinking about having an either-or approach.
And I will say that I've been in all buildings quite a lot, whether I'm dancing or walking classrooms, and the staff are doing a phenomenal job. We welcomed our pre-K learners back. They all had their mask on. They all were following. Teachers were having students to wash their hands when they entered. And even our families, as they dropped off and walked their little people in, it was cute. They were waving, watching their kiddos go in, but staff are doing everything that they can to ensure the safety of students. And I will tell you that they are doing a phenomenal job just based on what I'm seeing. And also, when they see something that needs to be addressed, they have not shied away of having those conversations, whether it's students, whether it's staff, or even those individuals who are on campus doing construction. The conversations are being had.
So I certainly appreciate all the mitigation measures and the fidelity with which they're being implemented. Remind me, what is the difference, though, between an exposure for a staff member who is vaccinated versus not vaccinated. So if you had a confirmed child in your classroom that is COVID positive, what happens if you're a vaccinated teacher? What happens if you're not a vaccinated teacher?
I'm going to welcome Vince to respond to that one.
Thank you.
I had a feeling that question would come.
You have to come get a microphone too. Sorry. You have to.
So with regards to a staff person who's vaccinated or unvaccinated, so the good news about a vaccinated staff person is they don't have to quarantine, as long as they're following the mitigating measures and are asymptomatic. That's great. As you know, there's modified quarantine for students, but that does not apply to unvaccinated staff members. If an unvaccinated staff member has significant contact with a COVID-19 case in their class, which would be particularly more likely to happen with K-6 because they're with them all day and they have shared airspace, they would have to quarantine for 10 days likely and be out of school.
Okay.
And so depending on how they're feeling, we've done work from home things, but they would not be able to be present in the classroom. There's not a modified quarantine option for staff.
Okay.
Okay.
And Vince, what does that look like with a shortage in subs?
It doesn't look great. I mean, we would probably have to kind of cobble together I know the district had some wisdom to hire permanent kind of TAs and stuff, so we would have to kind of cobble together some coverage through TAs, assistant principals, additional staff. Roxanna would dust off her history teaching skills.
Done it many times before.
I mean, we would have, the students would be doing something with caring and smart staff, but we would have to probably cobble that together.
And for some schools, has that resulted, if you know, in them having to go back to virtual?
Not yet, but I'll let Dr. Jameson.
I do actually have a
here we go.
response to that. So we did talk about that during our call today. So we do have some schools that have full classes, some depending on if they're mask optional, which has had the largest impact. And so the conversation today for those school districts that have gone mask optional is now that they are requiring the classrooms to start wearing masks. And so they've identified varying metrics, and so they're finding that their positivity rate and transmission rates in schools are increasing because they don't have masks. And so when you begin to talk about the impact to staff, whether vaccinated or unvaccinated, it could create a strain on the district.
And our goal is to stay in person as long as.
That is
and
correct.
as much as we can, right?
That is
And
correct.
So it sounds like that would go against our goal because of what it creates, the quarantine alone. Okay. Thank you.
I wanted to follow up on something that Cindy had mentioned, that with the testing, there will be positive cases that come up. So obviously we want to catch those. I'm just curious kind of how that sort of shifts the demand on subs and versus just deciding everybody needs to be vaccinated. I guess I'm not being very articulate, but are we prepared to deal with the eventuality of those positive tests coming through?
That would, if you're talking about a sub situation, that's probably easier to deal with as a sub situation than the likelihood that many staff members may just leave and then you have permanent vacancies. So, there are two sides to that and you're kind of weighing that.
And you're still gonna have some positive cases with everyone being vaccinated, right? So we're still.
And we talked about that too with breakthrough cases today during the meeting. I will say that the benefit is that we can have an opportunity, as Vince explained, for those who are vaccinated, they can stay as long as they're asymptomatic. Because the goal is to offer in-person learning, and we know last year what the impact was not only on our pre-K littles, or I call them our littlest blue devils, but what it could be as we think about opportunities outside of just academics. And so that's where we are.
Yeah, I mean, I just, as somebody who's been part of the conversation for the last, year and a half, and the acknowledgement that when it comes to COVID, we have been about as cautious as you can be. You know, I think that, you know, it feels as though there is, you know, we're leaving something on the table here with the option for testing, as opposed to a blanket vaccination requirement. And again, I know both have consequences, and nothing is going to be 100%, you know, fail safe. But just wanted to express that here.
Thank you for that.
Does anyone else have any questions?
I don't have any questions, but I want to thank the administration for the incredible deep dive on this and being very transparent. And thank you, Cindy, for always having our back and researching for us.
I will also say that last item, the recommendation for the universal mitigation measures would have to come every 30 calendar days. So.
Yeah.
And so we're voting on that tonight, is that right?
Yes.
Can you tell us exactly what your recommendation is?
The administration is recommending that all employees be vaccinated against COVID-19 by October 10th, 2021, or undergo weekly COVID-19 testing, in addition to reinstating the MRH temporary COVID-19 leave up to 10 days for vaccinated staff, with unvaccinated employees being required to use available leave or take unpaid vacation. And then the last recommendation is to approve MRH's universal mitigation measures collectively.
And will we have to vote on the mitigation measures monthly?
We will, every 30 calendar days. And so Kat is already looking at what that looks like so that we can have that on the agenda when needed.
Okay. Okay. Does anybody else have any questions?
I am intrigued by the idea of incentives for students to be vaccinated and have a sense. Again, I know we kind of talked about it at our last meeting, but that there is some opportunity for partnership with our municipalities on that. I don't think it's something that we should decide about tonight, but certainly something that be interested in hearing, you know, from students, from staff, administration about what that could look like. And, you know, also to that point, the idea that, you know, as we heard last meeting, that some of the hesitant staff in the district may be because of the waiting on FDA approval. And so I hope that we are continuing to have, you know, those peer-to-peer encouragement conversations, whether it's with, you know, students, whether it's with parents, whether it's with staff who have not yet received the vaccine.
I will say I had an opportunity to meet with our student council members, and they are a lively bunch. Sent a formal email, and it was good conversation, and we will be meeting quarterly, but I definitely can have Kat to reach out to their rep and schedule a time for us to talk about incentives. And I am meeting with the city manager for Maplewood. Will do the same for Richmond Heights, and I can provide an update at the next board meeting regarding incentives for students.
That would be fantastic. And I just want to quickly acknowledge that we had a lot of parents sign on to a letter that we received today, and I look forward to being able to activate some of those energies toward increasing vaccination for our families and our students, because I think that is really critical, especially here in Maplewood.
Well stated, Amber. I agree.
Absolutely.
I think that the next step is advocacy towards vaccination and how it is now approved. So thank you for bringing that up.
Yep.
Yes, absolutely.
And I hope that our families see that we are responding, because if you, again, you know, the shift to how we're presenting data on the dashboard and continuing to be transparent. And I, you know, some families, I say, hey, that's a great question. May not get the answer you want, But we are willing to listen, and for those things that we can do where we can pivot, we are able to do that too. So again, we did make those adjustments. We're continuing to find ways to have transparency with our families too.
Absolutely. Okay, action items. Can I get a motion?
I move to approve the MRH administration's recommendation to require all employees and partners be vaccinated against COVID-19 by October 10th, 2021, or undergo weekly COVID testing, to reinstate the MRH temporary COVID leave up to 10 days for vaccinated staff, and approve the MRH universal mitigation measures.
Second.
Thank you, Katie. Thank you, Rachel. All those in favor say aye.
Aye.
Any opposed? Unanimous? Motion carries. Next motion.
Move to adjourn.
Second.
All those in favor?
Aye.
Any opposed? All right, also unanimous. Meeting adjourned.
Thank you.
Thank you.
I appreciate everyone's work.